Today, we're going to talk about 6 Social Security mistakes that are going to be probably costing you or your loved ones money. How do I know? My name is Ed Weir. I'm a former manager of the Social Security Administration. I've helped millions of people navigate the entire bureaucracy that is Social Security. And I have to tell you that when I ran my office, I had about 100 employees in my office, and we did probably more training than any other office in the country. But unfortunately, of the over 1,500 offices out there, training is not doing very well now. They're barely keeping above water, and they're understaffed, worse than 50 years, and they've got a lot of new employees. So I've been doing these videos, done over 800 videos, and I've talked to people. This is also a live Q&A. So I'm going to talk about the 6 Social Security mistakes that cost you money, and then I'm going to open it up for any type of question. So if you have any questions on all things Social Security, retirement, disability, let's make sure you're getting everything you're entitled to. Go ahead and type your question in chat. If you're watching this in a recording later, make sure you subscribe, and that way you can find us in the future when you do get that strange letter from Social Security or you have a question. All right, let's get right into it. The number one thing that I've seen a lot of people missing money on is called independently entitled divorced spouse benefits. So we're going to talk about retirement mistakes, Medicare mistakes, spouse benefits, survivor spouse benefits. So the number one is independently entitled divorced spouse. What is that? It's basically divorced spouse benefits. There's a lot of people out there that are sitting around waiting for their ex-spouse to file for benefits, and you do not need to wait for your ex-spouse to receive benefits. As long as your ex-spouse is at least 62 years old and that you've been divorced for 2 years, then you can go ahead and start those benefits. So don't have to wait for your ex-spouse to file. You do have to meet the eligibility requirements. That is, you had to be married to the person for 10 years. Their benefit amount has to be twice yours. And in terms of independently entitled divorced spouse, you have to be finally divorced for 2 years. So don't wait. Tens of millions of dollars are probably sitting around there waiting for people to come collect those benefits. If you're currently receiving your benefit and you're sitting waiting around for your ex to file for benefits, don't wait. If they're 62, go get your money now. If you know anybody, this is a community project. If you know anybody that's in that situation, make sure you reach out and have them go file. Number two is health savings account and Medicare Part A. Social Security employees are never really trained about this because what happens is when you turn 65 years old, if you have a health savings account and you signed up for Part A, you can no longer contribute to that health savings account. So unfortunately, Social Security, because it's more of an IRS issue rather than a Social Security issue, because you have a health savings account, you're getting some benefits from the IRS. But if you have Medicare Part A, you lose those. So, and because Medicare Part A, when you sign up for it, it's like a 6-month retroactive period. If you have a health savings account and you want to go ahead and sign up for Part A at 65, you have to stop contributing to that HSA 6 months before. You can, take out withdrawal from the HSA, but you just have to stop contributing to it 6 months before. And this leads into another issue that Social Security employees, they can't give any recommendations. They can sign you up for Part A and Part B, but they can't talk about what's called Part C, the Medicare Advantage plans. I don't really like that term, Part C, but anyway, the Medicare Advantage plans. They can't talk about Medicare supplement plans. Those are the N, the plan N, G, and F. They can't talk about prescription drug plans because those are all administered by private companies. So you're kind of left on your own devices on all of that. We used to have people come in all the time and says, I need this and I need that. Well, sorry, we can't help you. You just have to go out there and kind of fend for yourself. And that's one of the reasons I partnered up with Chapter Medicare. If you need help, particularly right now with the annual enrollment period, and this is the worst Medicare enrollment period in decades because there's so many changes for 2025. Close to 2 million people are getting their plans canceled or downgraded or switch to another plan without their authorization. So if you need help to see if you're one of those, make sure you call my partners at Chapter Medicare and they'll help you out. That's 100% free. All right. One of the I'll get into number three, but I tell you one of the underlying factors of all this incorrect information from Social Security is the difference between what's called a CSR and a CS. A CSR is a customer service representative. A CS is a claim specialist. Before I was a district manager, before I was the assistant district manager, before I was the operations supervisor, I was what's called a Title II CS, a Title II of the Social Security Act, which does retirement, spouse benefits, survivor benefits, SSDI, Social Security Disability Insurance. CS is a claim specialist. So, and there's also Title 16, SSI. But anyway, when you go into an office and you don't have an appointment, you just have questions, you're talking to a CSR. They are generalists. They're not specialists in SSI or retirement or spouse benefits. They are generalists. And this is where I see a lot of people getting incorrect information. They go in there and unfortunately the person was just hired a year ago and they put them at the front windows without supervision, which is a terrible thing. And they're giving out all this incorrect information. People think that is an official decision and they walk out of the office and they've now lost, tens, hundreds of $1,000s over their lifetime because they didn't file for benefits. So it's important that you get an official decision when you're filing a claim or something like that. So if someone with the independently entitled divorced spouse, what I'm seeing is I tell people go to the office and get it, and they go to the office and they said, hey, Ed told me to come to the office and get independently entitled divorced spouse because my ex is 62. And the person says, no, your ex has to file. And they say, well, Ed said, no, Ed doesn't know what he's talking about. And then they come back here and said, hey, Ed, you don't know what you're talking about. And then I give them the reference number, which I'll put at the bottom of the chat. I'll go ahead and put the reference number right now at the bottom of the chat. So you have it, because when people have that reference number of the actual policy from the 20,000 pages of Social Security policy, they go into the office, back into the office again, and give that reference to that same exact person. And then that same exact person kind of starts looking sheepish and embarrassed and say, oh, I'm sorry. And so, but if they didn't go back there and ask for it specifically, they would have lost benefits the rest of their life. So number three, that you're not entitled to living spouse benefits does not mean you're never entitled to spouse benefits. What I see happening is that the calculations are throwing people off. So when you go into the Social Security Administration and you want to file for spouse benefits, then your benefit amount has to be less than half of your spouse's, your current spouse or divorced spouse. Yours has to be less than half, and you can get up to 50% of that person's benefit amount if you wait until your full retirement age, so that there's 50%. So your benefit has to be less than half. So people go into the Social Security Administration, or they call the 800 number and say, hey, I want to see if I'm entitled to any money on from my current spouse or divorced spouse or something. And the Social Security employee looks at the record of yours and your spouse's and said, no, you're not entitled to benefits. And what they mean is there's no more money. Your benefit is not less than half. And they should continue by saying, the Social Security employee should continue by saying, that's now. If anything should happen to your spouse or your ex-spouse, then it's no longer 50%, it's up to 100%. So I know there's thousands, tens of thousands of people out there walking around who are entitled to more money, need that extra money, but they were told 10, 15 years ago that they're not entitled to benefits on their spouse's record, so therefore they're not getting it. And that person has since passed away, and now they could get an extra, a few $100s, $1,000, whatever the case may be. And so we need to get that information out there because, the calculations change. Another thing that Social Security employees, and not many people do this, so they give out the wrong information all the time. It's called voluntary delayed retirement credits. It's basically, if you are receiving benefits, you can voluntarily stop your benefits at your full retirement age. So if your full retirement age is 67, you can actually stop your benefits anytime after 67 and restart those at 68, 69, 70. Because if you wait until your full retirement age, you get that extra 8% every year. So if you never collect benefits and your benefits are, let's say, $1,000 a month, if you wait until you're 70, 20%, 24% more, you'll get $1,240. But a lot of people don't know that even when you start your benefits, you're approaching your full retirement age, go into Social Security and say, hey, I want to voluntary stop my benefits to delayed retirement credits. And again, they will look at you like you're crazy. And then you just provide the reference. So another thing is number 5, check your earnings record yourself. When I took the hundreds of thousands of retirement claims that I adjudicated when I actually worked at Social Security Administration and in the old days before COVID and everything, we used to do mostly in-office appointments, and you would come into the office and the Social Security employee would print off your earnings record and then push it across the desk for you to check, because that is the most important thing to make sure you're getting every penny you're entitled to is your earnings record, how much you actually paid into Social Security. Social Security, calculates your benefits based on your high 35 years of earnings. And if those earnings have some missing years or incorrect years, you're not going to get the right check for the rest of your life, nor is your spouse or your surviving spouse or children if they're entitled. So your earnings record is extremely important. And so now with everybody doing on the internet and people doing it on phone, they forget to check that. The Social Security employee, they're skipping that step a lot of the times. So this is another reason to go into socialsecurity.gov, set up a My Social Security account and check your earnings record. And please tell everybody you know, young people particularly, tell them once you file your taxes in March or April or whatever, you're not done. A few weeks later, go back in the Social Security account and make sure those earnings got to Social Security, because if they didn't when they're young, 20, 30, 40 years later down the road, when they go file for benefits, it's harder to correct that record. So it's important that you check consistently and fix it if something is an issue. Another thing I see a lot of people, they're having issues with, if you do find something missing in there and you have a question, you can actually request from Social Security a more detailed earnings record, because if you go online, it just basically, tells you what your earnings record is and stuff. But if you want more details, specifically what the company name was, what the address, the employer identification number, all the details, how much you paid on that particular company for FICA, Social Security versus Medicare, whatever, gives you a lot more detail. It's called a DQUE, detailed earnings query. And if the issue is people that are, let's say, applying for the police department, they need a background check. So the police departments throughout the country make them go down to Social Security and get a 10-year DQUE. And Social Security has determined that's not something, that we do background checks. So they charge for that over $100 for a couple of pieces of paper, so it's pretty awesome scam there. Anyway, not a scam, but anyway. But if you go down there and ask for that, they might try to charge you. And so basically you have to say, hey, this is program related. I think my benefits are incorrect. And therefore I want to see it, 1982, I worked, it shows 0. I want to see exactly, that particular year and see what's going on. And they should be able to help you out there. There's some gray area there. Social Security really needs to kind of fine tune that little policy so people can get their benefits and correct any mistakes. Number 6 is, and I'm going to give you a bonus here in a little bit. I always like to give everybody bonuses. And then once I finish this last 2, then I'll open it up for questions. So protective filing. Social Security employees are missing this. If you called Social Security 2-3 months ago and asking about retirement benefits or disability or survivor benefits or whatever the case may be, and you didn't get an appointment for a month or 2 months, or you missed your appointment, or they didn't call you, or whatever the case may be, and then 2 or 3 months later, you go in there and sign up and start your benefits, remember that you did call 2 months ago or 3 months ago. So you can backdate that check. If it's been 2 or 3 months because Social Security, whoever messed up, you can say at that time, so, okay, start my benefits this month. Oh, wait a second. I did call you all 2 months ago, or I walked in the office 2 months ago. Social Security has records of that. They have the phone records, and they also have, if you go into the office, it's called Viper, or some offices call it Vipper, a visitor intake process. Yeah, the R is it was redesigned. So anyway, that's that little stupid kiosk that you punch in when you go into the office. My office got rid of the kiosks as everybody was pressing the wrong buttons. And so anyway, so if you called earlier, make sure you get those back. Make sure you get that back pay. All right, and the bonus is to remember, Social Security employees do not provide financial advice. We used to provide break-even points. So if you were like saying, oh, should I go ahead and take my benefits now, or should I wait 6 months? Social Security used to run the numbers. I used to run the numbers and say, well, you're going to make $30 more if you wait a few months, but you're going to lose, $3,000 of the checks, and that's going to take you like 14 years to make up that difference. So, what Social Security said, no, we don't provide that. That's kind of financial advice, and so they stopped employees from doing that. Break-even calculations, whether you should file for survivor first or retirement first. So unfortunately, in a lot of cases, you're pretty much on your own. Even if they could, they don't have the time to, spend with people. And there's a lot of companies out there that will give you a break-even analysis, and they'll, charge you like $300 or $400 or $500 for that. And those are all pretty much a waste. You just have to watch one of my 800 videos or come in and ask a question, and we'll help you out. Save yourself $300 or $400 or $500. All right, let's go ahead and jump into the questions. Looks like we already got a lot of questions. Let's see what we got here first. Mary, I was married for 10 years, divorced. My ex-husband turned 65 this year, but retired 10 years ago. He previously always paid the max. What will this look like for me when I go to collect in 5 or 6 years? 5 or 7 years. Yeah. So it just basically, you start your benefits at the earliest, 60 years old. Whatever his full benefit amount is, you get 71.5%. So if he paid the max for 35 years, then his benefit amount should be, his primary insurance amount is what they call it, should be about $3,600. So you'll get up to 50% of that minus your own, because you have to file for benefits on your own record first. Again, the earliest you can do it at 62, unless the person has passed away, then you can start benefits at 60. So you have to file for benefits on your own record first if that person is still out there alive and kicking. Cheerful lady, I will be 65 in February on SSDI since 1995. My former spouse passed 2019 at 56 years. Appointment with Social Security to apply for survivor benefits. Does the cap 82.5% apply to me? Does Windex apply? So you are 65. So it really, your former passed away. No, your former spouse passed away at 56. So they were not receiving benefits. So the widow's cap, that 82.5 and all that stuff, won't apply to you because your ex was never receiving Social Security benefits or retirement benefit. They were receiving disability, then that doesn't matter. Windex PIA does, because he passed away before the age of 62. So they index his earnings for, basically, rather than 56, they Windex him for at 60 years old. But that should be automatic. But yeah, make sure you ask. All right. How can my girlfriend get on Medicare? She just had a stroke. Have to be, for Medicare, you have to be 65 years old or disabled. And if you're on Social Security Disability, SSDI, Social Security Disability Insurance, you get Medicare automatically after being on disability for 2 years. I know I disagree as well. I would argue that if you're approved for disability and your check starts this month, I think your Medicare should start this month as well. But unfortunately, for whatever reason, they don't start it for 2 years. So you have to find, the Affordable Care Act or whatever the case may be. If you applied for SSDI and they continue to deny you for years, can they later tell you that you now have no credits and are disqualified, or can you argue that your initial application had credits? Yeah, you can appeal. Your NALUC is talking about the date last insured. So for Social Security disability benefits, you have to meet 2 insurance criteria. One is that you have to be insured for SSDI. There's SSI, which is a welfare-based program for people that low low SSDI or not insured for SSI or for SSDI. Um, so if you're insured, you pay the 10 years, 40 quarters. That means you're insured for disability, retirement, survivors, and all that kind of good stuff. But you also have to be currently insured. That means you worked 5 out of the last 10 years. So it sounds like Nolak was applied 5, 6 years ago, denied, applied again, and this time they said no. You're not insured. You haven't been working 5 out of the last 10 years. And so unfortunately, Ray judicata probably applies in this one where they say, yeah, it's going to be a tough one, unfortunately. But you can always appeal. Yeah, you can always appeal. Maybe they, can find something in there. The number this Medicare change every year. The numbers yeah, I'm not sure what Medicare plans change every year. Well, if you have Medicare Advantage, all Medicare Advantage plans end December 31st, and then a new one starts. You might have the same company and the same card and the same doctor and the same premium, but usually, particularly this year in 2025, pretty much everything under the hood, all the fine print changes. So a lot of people and insurance know this. A lot of people don't check their plans, so the insurance companies can do whatever they want and then jack up the prices. And you don't know until you actually get sick or fall, have to go to the hospital, and you're like, wait a second, when I signed up for this plan, it was only $100 a night at the hospital. Now it's $500 a night. Yeah, it's been like that for since January or since last year, but you never checked, and that's what health insurance companies are hoping you do is don't check. So, but we're going to be smarter than them and reach out to the person that signed you up, your Medicare broker or whoever, or call chapter, and they can check to see if you've been canceled or downgraded or whatever the case may be, see what kind of sneaky things the health insurance companies have done. I called in August to make my appointment for widow's benefits to begin January 25. Perfect. All right, good deal. I collected my Social Security at age 62. I also collected on X's Social Security. He worked 10 years more and made more. Can I get an increase on his Social Security based on his larger income? Sounds like you already got it. So you collected your benefits at 62. You also collected on your X's. So you've getting everything you're entitled to. But maybe what you're asking is your X is still working. And yeah, if your X is still working and paying into Social Security, you'll get the COLA. Obviously, everybody gets the COLA. That's automatic. But if your X is still working, or you are still working, anybody, and paying into Social Security, and that's one of your high 35 years, then Social Security automatically recalculates and jumps up your benefits. So if your X continues, call them up and call your X and say, hey, how many hours did you work this week? Only 80? Come on, you can pump out 100. I know you can do it. And their benefit will go up, and therefore your benefit will go up. So I'm sure your ex would appreciate that phone call. Retired at 63. Wife was on SSDI, 67 now, and she has passed. Wow, sorry to hear that. Retired at 63. You're 67 now. If your wife passed, if her benefit amount is more than your benefit amount now, then definitely go get those surviving spouse benefits. Let's see. I called to set an appointment for January widow's benefits. My appointment was set for October. The rep said he would pend my application due to setting up an appointment too early. Why would they pend? Yeah, it's just basically a protective filing. So if you have your appointments in next month, let's say, and you want your benefits to start in January, then no problem. Just tell them, hey, I want my benefits to start in January. But you have the ability to go back this month, or if your appointment was for October 7th, then that means you probably called in September for the appointment. So technically, if you wanted your benefits to start in September, you could say, hey, I don't want my benefits to start in January. I want them to start in September, so you can get those extra checks. But obviously it's going to reduce because you're getting those benefits early. If you're under full retirement age, if you're working this year, there's the annual earnings limit. So, but that is your right to kick around those numbers and see if you want those extra checks. My ex turned 65 in September. He's still working and gets insurance with his employer. Does he have to apply for Medicare now? No. If does not have to do anything. If you are approaching 65 and you have health insurance from work, yours or your spouse's current work, it can't be Cobra or a retirement plan or the Affordable Care Act. It has to be current work. And that plan has to have 20 or more employees. Then you do not have to sign up for Part A, Part B, anything. And then when you turn 70, 75, 80, 90 years old and you stop working, stop receiving health insurance from current work, then go ahead and sign up for Part B. Some people go ahead and just sign up for Part A because it's zero premium anyway. But again, you've got the health savings account. You can't contribute to a health savings account anymore. And another thing, this is not Social Security related, but if your ex's employer says, hey, we want you to sign up for Medicare, and if you don't, then you're going to have to pay these extra bills. So I always recommend, you know, talking to your employer because these private plans are trying to save money, so they move the cost over to the federal government, over to Medicare. So talk to your employer, says, hey, are you making me sign up for anything like Part A, Part B, because I'm turning 65 here? So yeah, so definitely check that out. And then once you do sign up for Part A, Part B, then you'll need something to cover all the gaps. Original Medicare, Part A covers the hospital, Part B covers the doctors. But if you go in and see a doctor and they give you a $10,000 Band-Aid, you're going to pay $2,000, 20% coinsurance. So that's why people either get a Medicare Advantage plan or a Medicare Supplement plan, whatever best for you in your particular situation. And you can call chapter there and they can review everything in your area and see what is best for you and give you all your options. That is 100% free. I received a note that my new Medicare has started. I called and canceled fraud, was told that my power of attorney for my husband needs to be a rep payee, which I must get from, what is this? Yeah, I'm not sure what you're, talking. But yeah, power of attorney, yeah. Social Security does not recognize power of attorney. People come in all the time and says, yeah, I want to take care of my father or grandfather or whoever's benefits, and I have a power of attorney. Power of attorney means that person is of correct mental faculties that they are able to appoint you as the power of attorney. So if that person has the ability to appoint you as the power of attorney, that person also has the ability to take care of their own Social Security benefits. That's how Social Security views it. If a person wants you to take care of their benefits, then you get appointed as a representative payee, and usually have to have a doctor's note or something like that that says that person is not able to take care of their own benefits, because Social Security always wants to pay the actual beneficiary. They don't want to have to pay anybody else and have someone else in between. If you're able to take care of your own benefits, they want you to get your own benefits. If you're not able to, then representative payee. A power of attorney means they can take care of their own benefits. So unless for fraud on the power of attorney side. Will I receive 100% survivor retirement disability when I reach my full retirement age if I am currently receiving a reduced amount? No. So let me read in between the lines here. You're receiving 100% survivor's retirement disability. So if you're receiving okay, will you receive 100% when I reach full? So you're already receiving a reduced amount. As long as you continue to get those checks, your benefits are always going to be reduced. So no, it doesn't switch. Could you imagine if you get 62 years old and you take a reduced amount, and then when you hit your full retirement, it's automatically go to full amount? So it's no use. Social Security would go bankrupt, and or the trust fund wouldn't last to 2034. It lasts till, what time is it now? So, can I stop my current benefits and earn delayed retirement credits and file on my ex-spouse's income? Yeah, if you're currently receiving benefits on your own record and you're approaching your full retirement age, you can do the voluntary delayed retirement credits. Yep. Again, you're going to have a little bit of challenges with local office because not many people know about it, and therefore not many people do that strategy, and therefore Social Security, particularly the front windows, those CSR, the customer service representatives, they don't know about that. So I would schedule an appointment. I'm 59, was just approved for SSI, and I had a telephone interview about disabled widows benefits, and they said I had to wait until next year because they only have a window of 7 years from. Okay, so you not this is not SSI. SSI is the welfare based program. If I'm um, so I'm just trying to read in between the lines here and answer the question I think you're asking. If you're receiving SSI, then this is completely different. But So you had a question about the disabled widow benefit. So yeah, between 50 and 59, you can collect disabled widows benefits, but there's a 7-year window from the death of the deceased. Yeah, when they passed away. So, but they said they had to wait until next year because they only have a window of 7 years. So yeah, I'm not sure why they have. Or okay, maybe you are receiving SSI, and then because you're receiving SSI, anytime you receive an SSI, which is the welfare-based benefit, and you're entitled to any other benefits, you have to file for those other benefits. But I'm not exactly sure why they're waiting to tell you next year. I'm not sure about that. Yeah, that doesn't. Not sure what their logic is. My husband, power of attorney, wanted to see if he also had fraud Medicare application. They said to get rep pay. Okay. Yeah, I'm not sure what you're talking about there. Ed, is there a reference number for the DEQ? Because that happened to me when I asked about this and was told it would cost me. Yes. Let's see here. I'm going to look through my references, disclosure of, okay. I just put it in the bottom. There's the reference. And again, Social Security, the reference is, it's not written as well as it should. And every time I talk about this, I always say, hey, Martin O'Malley, the Commissioner of Social Security, I know somebody from the headquarters back in Baltimore watches me, and y'all need to rewrite this. And if this is program related, because so many people going online now, and they're not checking their earnings record, and therefore they're receiving incorrect benefits, you have to make it easier for them to get a detailed explanation of particular years. So don't make it so difficult. I understand y'all want to make money by charging these people, for the background investigations. I know that's not Social Security's job, is to provide background, investigations for police departments. So I understand. Okay, go ahead and charge. But if someone just comes in there and they just want, 1982 and 1983, and they don't want a fancy stamp or something like that to prove it's an original, like the police departments do, then just give it to them. Just give it to them. Y'all need to step up there and do the right thing. So there's my soapbox. The Social Security office keeps telling me lies. I'm almost 60 a month ago. Deceased spouse benefits. If my ex 67 makes more, can I at 60 ask for his? I appreciate. So if you're, you, in order to be entitled to surviving spouse benefits or deceased spouse, whatever widow's benefits, widower benefits, basically the same thing. If you have to be 60 years old, that benefit has to be more than, well, in survivor benefits, you can not file for benefits on your own record. If you're currently receiving disability, it has to be more. But if you're not receiving any benefits, you can start benefits at 60 years old. You had to be married to the person for 10 years if it was a divorce, or you had to be married for at least 9 months if you were married to the person when they passed away. So you can file for survivor benefits, collect those benefits, don't touch yours, let yours continue to increase. Yeah, so I'm not sure what they're saying that you're not entitled to. And obviously your work limitations. You're limited to the amount of work you can do. Anything over that, the $22,320, they hold back $1 for every $2 you go over. I am disabled and legally legally blind. I do my full benefits. I do get my full benefits, but I wanted to know once I reach my Social Security age, do I receive more income or the same? You'll get the same. As long as you continue to get checks, you'll get the same. It won't be an increase or anything like that. The only thing that will happen is once you reach your full retirement age, you'll stop receiving disability benefits and you'll just receive regular retirement benefits. And the amount stays the same, direct deposit date and everything stays the same. It's just a bureaucratic thing that they switch from disability benefits to retirement benefits. But the good thing is you're no longer on Social Security disability, so you can do whatever you want. You're, work limitations or anything like that. What is the copay protection plan? Copay protection plan. I'm not sure. Is that maybe the smoothing thing? Part D for next year. This is one of the reasons there's so much turmoil in Medicare for next year, and why you have to check your Medicare plan. Is that one of the big things is the Part D this year? Pharmaceutical, the Part D plans can charge you up to $8,000. Next year, it's only $2,000. So, but even then, if you have a very expensive medication, you hit that $2,000 immediately, like in January and February. So you pay $2,000 in January, $1,000 in January, $5,000 in February, and then for the rest of the year, you're good. The problem is, coming up with that $2,000 in the first 2 months. So there is this smoothing thing. Do they call it? It's a brand new thing. Was it? Maybe it's called the co-pay protection plan. Anyway, they also call it smoothing, where you can say, hey, I paid $2,000 first 2 months, but can we smooth that over 12 months? So they take the $2,000, divide it by 12, and then you pay that amount every month. So it's a little bit easier on you. And you just reach out to your Part D plan and you ask them about that. Let's see. Yes, please like and subscribe and all that kind of good stuff. That's how we teach the YouTube algorithm that not only cat videos are important to people out there, but getting money is important. The money they paid into. If I SSDI till my dad died, then got survivor benefits when my dad died, and amount of back pay likely. Yeah. So possibly what you're talking about is you're receiving benefits from your parent because you're a disabled adult child. When your parent is alive, then you get 50%, up to 50%. When the parent dies, then you get 75%. And it should be, backdated to the month of that person's passing. What if I don't know my ex's Social Security number for divorce spouse benefits? No problem at all. Super, super easy. I've done this about 1,000,000 times. You just when you call Social Security, you tell them that person's name, I was going to say their Social Security number. No, you tell them their name, their date of birth, and the city and state they were born, and as close as that, as you can get, and they should be able to find it. Sometimes it's a really common name, like, John Smith or something. Then they'll say, okay, well, we also need, that the person's, parent's name, the mother's maiden name, the father's name, mother's name or something. But I've never not been able to find someone's Social Security number. When I worked at Social Security, people had, well, I think their name was, here's their name, but I think they were born in sometime maybe 60, 61, 62, and somewhere in North Texas. And I was able to find their Social Security number. So, it's pretty easy. I have A and B. Social Security automatically put me on A and B. Can I cancel B? I need dental instead. Okay. First part of your question, can you cancel B? Yeah. If remember that if you cancel it and you don't have other health insurance from work, when you go and sign up again, then they're going to penalize you 10% for every 12 months you did not have Part B. And they're also going to penalize you for not having Part D as well. That's 1% for every month you do not have Part D, as in drugs. If you're saying, okay, you want to cancel B, you can't cancel A and receive benefits. So if you're receiving benefits, you're automatically enrolled in Part A. But yeah, if you need dental instead, those are because A and B doesn't cover dental, and just go get a standalone dental plan. But if you have Part A and Part B, and the issue is maybe the price or something like that. What you can do, what there's an option is you keep your A and B, and then you sign up for a Medicare Advantage plan and zero premium, and you can get one possibly. It depends on your area. What's called a Plan B, Part B give back. So it pays for part of your Part B, the $174.70, it pays, $50, $100, all of it, depending on what's available in your area. And those also have dental in them. But because the company is paying for your Part B, the dental is probably not the best. So a strategy that you might consider is go ahead and get one of the Medicare Advantage zero, premium plans, not the Part B give back one, but get one that has the most dental, and then get your dental done next year. And then the following year, get to a Part B give back. So again, it depends on what's available in your area. Call my partners at Chapter, and they can tell them what your strategy is, and they can see what's available in your area. And that way, you are fully informed and you make a correct decision. Jerry retired at 63. Wife was on SSDI. She passed this summer at 64. Can I collect hers and suspend mine for her full amount? She has a larger benefit amount. So retired on SSDI. She passed this summer. Can I collect? Can't really suspend yours because unless you're talking about you're close to your full retirement age. You can suspend it by saying, giving a work report and saying that you're going to make too much, but then that kind of defeats the purpose. Um, and if you filed for years within the last 12 months, you can actually withdraw that application. But yeah, I would, you can add her benefit on top of your benefit amount. If hers is a larger benefit amount, then you just go ahead and file for regular surviving spouse benefits. The numbers of Medicare. Okay, already asked that. So if my ex's kicks the bucket and he did remarry, but I didn't, can I still collect on his Social Security? Yep. Doesn't matter if your ex married or remarried 3 times or 5 times. You can remarry yourself, but you have to remarry after the age of 60 years old. If we are both 65 next year and both starting drawing, I am a high earner drawing 25-30. If I pass, how much would my wife receive? If you pass if you pass away when she is her full retirement age, she'll receive $2,530. She'll receive 100% of your full benefit amount. Well, if you're receiving 25-30 minus, and that's also includes the deduction for Part B, then she'll receive 26 or whatever, 27. But yeah, she'll receive basically what you're receiving if she is her full retirement age at that time. All right. Question about timing of stopping my wife's HSA contributions. If she is let go, does she have to go on COBRA for the 6 months, or is there a loophole for being terminated? Yeah, unfortunately, no loophole. So again, it's only it's an IRS issue that everybody I've talked to said it's not super a big deal. What it is if you give $100, $200 or whatever to your HSA every year or every month, let's say, you're getting, you're able to take that off your taxes. And so you're, saving what, $5, $10, $20 or whatever on your taxes. But if you have Part A at that time, you just won't save that for that 6 months. So what happens is you do your taxes next year and the IRS says, hey, you owe us, $47.37 because, we gave you a break on your HSA and you had Part A. So it's everybody I talked to has said it's not a big deal, but it's good. People hate getting, letters from the IRS. So I think that's the issue rather than it's not usually the money. It's, I don't want any, flags or anything from the IRS. So, okay, I already answered that one. Okay. It is all the money draw that we cannot afford. Okay. All right. Hey, Imagineer, what's up? Let me get some people I don't recognize here. Oh, what is the earliest I can get 100% survivor benefits, full retirement age? Neither of us filed for any Social Security. Spouse died at 65. Got any references for the CS appointment? Yeah. If you're your full retirement age, you'll get 100% of that benefit amount. So, I mean, the benefit amount could be even more if the person didn't file. You'll receive the full benefit amount. That is the benefit amount that person would receive at full retirement age. If that person didn't file and they passed away at 68 years old, Social Security assumes that they were waiting for delayed retirement credits, and you'll also get delayed retirement credits up to the month they pass away. So survivor benefits are always a little bit difficult to calculate out because there's so many moving parts. Spoke with Diana from Chapter. Due to high price supplement plan, I have to go with Advantage plan. Diana was very helpful. Her callback was within hours. Awesome. Good deal. So far, 100% perfect response from everything people that reached out to Chapter. So good, good, good. Yeah. I wish the prices on Medicare supplements, because if you watch my channel, you know I always recommend Medicare supplements first, the Plan N or the Plan G, because you don't have networks. You can go anywhere you want. You can don't have to have the referrals, don't have to have prior authorizations, all this other kind of crazy stuff. But unfortunately, the monthly premium is why almost everybody doesn't get it. So if it's a budget issue, then Medicare Advantage, it's fine. um, you still get your coverage and everything. You get some extra benefits, and your Part D is included in there. But it does take a little bit more effort. I mean, an hour a year. So at this time during the annual enrollment period, you have to suck it up and grab your cup of coffee and call my partners at Chapter and say, okay, all right, let's do this nightmare again, because we all love talking about insurance, right? Yeah. Anyway, so you call them up and say, okay, here's my doctors, here's my prescriptions. Okay, what's the best plan for next year? Okay, let's go ahead and do it, because Otani is going to be starting here pretty soon in the Dodgers, and so hey, I've got my priorities. Anyway, so my child just diagnosed with level 3 autism, which required me to stop working. Does she qualify? Yeah, I did a video on this. I was asked to do a video on this by Autism Oklahoma. So I did one a few weeks ago on disabled adult children. But yeah, file for benefits. Absolutely. If you, so the child would file for SSI, Supplemental Security Income. It's the welfare-based benefit. If you or the other child, the other parent are receiving retirement benefits or disability benefits, then the child can get benefits as just a regular child under the age of 18. But they can continue to get it as an adult if they became disabled before the age of 22. All right, let's see here. That's the same question. Thank you for your channel. So kind of you. You're welcome. You're welcome. I'm ignoring it. If a spouse passes, does the ex-wife and current wife receive of how much each? They both receive the same amount. Well, depending on when they file, how old they are when they're filed, but one does not affect the other at all. Could you imagine that? If ex-spouses, oh, I was married to the person for 20 years. Oh, I had to tolerate the person for 30 years. I should get more. And how come you're taking some of my benefits? And yeah, no, one does not affect the other at all. If I'm taking my Social Security now, can I change to get half of my husband's Social Security? You can't change, but you can add that benefit amount. So you have to continue to receive yours. And if your husband's benefit amount or your ex-husband's benefit amount is twice yours, then you can get that benefit amount. I applied for death benefits, 24 years married. Guy asked for dates, previous marriage, and divorce dates of first. Yeah, so that sounds like the person is doing their job. So if you go in there and file for benefits, survivor benefits, retirement benefits, spouse benefits, or anything like that, the Social Security person will see if there's, if they're doing their job right. They will see if there's any more money out there for you, because a lot of people don't realize that, they go in there and they just got divorced, and now the person is 62 and they want to go ahead and file for benefits on their own record, and then they want to file for benefits on their most recent spouse. But the Social Security employee asks, well, were you married any other times? And you might not realize it, that maybe your first husband that you were married to for 10 years, went off and made a whole bunch of money, and there's more money there. So that's the Social Security person's job is to find you the most money in that particular thing. They can't do the financial comparison. That's up to you, but they're supposed to see what record provides the most money. I'm not going to affect my benefits because I'm trying to. Oh, okay, wait a second. I work for the post office, but I don't finish my paper of retirement with a kid. Okay, not sure what that means. What's the COLA raise for next year? An exciting 2.5%. Is the Advantage program between $1,000 and $3,000 real or a scam? Not sure. The Advantage program between 1,000 and 3,000 real or scam. Maybe the only thing I think of there, maybe what the person is asking is Medicare Advantage, the dental, 1,000 to $3,000 for dental. I've seen it up to Thomas from Chapter was we did a live yesterday, and he said he's dental $20,000 because some dental pro Advantage plans are now covering more dental. But no, that's yeah. If it's available in your area, absolutely, absolutely. And then there's another kind of. It's not a scam. People think it is. It's definitely advertised scammy. Is those grocery cards, the over-the-counter drug cards and stuff. Those do exist. They're really rich if you're. They have a lot of benefits if you're receiving Medicare and Medicaid, which you can receive both in Medicare and Medicaid at the same time. But yeah, they do exist. But how they're advertised is scammy because what we've seen happen is finally the government said people can't do this anymore. But you have some company or health insurance, whoever, in Paris, Texas. There's, let's say, for instance, there's a grocery card there that has $1,000 a month. And so that company in Paris, Texas will advertise it to the entire country. And then people from Bradenton, Florida and Topeka, Kansas will call up and say, yeah, I want $1,000 grocery card. And they say, oh, do you live in Paris, Texas? No, I don't live. Well, sorry, can't get it. And then they already got you on the line. They got your information. And then they do the hard sell and try to sell you whatever else. So that's called a kind of a bait and switch. And Medicare has finally come down and says you can't advertise to places that don't have those. So that's why every time I say this, it really depends what's your area, so I don't talk about specific plans. So I always like to stay 100% above board. Let's see. I just started getting survivor benefits. Is there a raise coming soon as November? No, just a general COLA increase starting in January for everybody. What's the difference between HMO and a PPO? Yeah, HMO is a more limited network. Those are Medicare Advantage plans. If you have a Medicare supplement plan, I always like to say, if you have a Medicare supplement plan, your network is America. Any doctor in the country that takes Medicare, any clinic that takes Medicare, any hospital that takes Medicare takes your Medicare supplement. Doesn't matter what company you have. But Medicare Advantage, they have HMOs and PPOs, just like, the Affordable Care Act and stuff. So an HMO is a more limited network, that has, usually you can actually save money because the insurance companies save money. They make, they have contracts with these doctors and hospitals. But a PPO is a larger network that you can go outside and go to any place, but it usually costs you more money. In bigger cities, I always recommend HMO because there's plenty of doctors. Usually within those networks, there's plenty of doctors, unless you've got, some that just out of it. But if you're living in the kind of the rural area, the country area, out in the desert or someplace, then you probably need a PPO because you're probably not that many doctors in the HMO in your particular area. You probably need to drive to the big city to, get really good care. So usually it's a PPO. And people that live out in the country, in the city, in the rural areas and stuff, those are the people that their Medicare Advantage plans and their Part D plans are being canceled because health insurance companies, they're not making a lot of money on y'all. So they're canceling people left and right or downgrading their plans to such an extent. If you looked at the details, you would cancel and switch to another plan, maybe in the same company, because all these companies pretty much, they have, you got Medicare insurance company XYZ. In your area, they probably have 5, 6, 7, 8, 9 different versions of plans. So people always tell me, oh, I've got, whatever, Crow Insurance Company, and I love them. And it's like, well, yeah, you've got their plan from 2 years ago, and they've upgraded that plan, since then, and you're on the old 1972 Pinto version, and they just came out with a new Corvette version. And why don't you switch to the Corvette version and save yourself a lot of money? Sorry for Pinto fans out there, but anyway, let's see here. Ed is the best. Thank you. Is there a rule that states Social Security can cancel SSDI if you become SGA 1 year after becoming disabled? Yeah, if it's Social Security defines disability as the inability to work. So if you have that trial work period, that 9 months when you're receiving SSDI, you can work 9 months, don't have to be consecutive, and make as much money as you want. But after that, then they start evaluating. So if it looks like you're able to work, they send you a medical CDR or work CDR, the continuing disability review. And if it determines that you're able to work, yeah, they can absolutely cancel you, stop your benefits. Absolutely. If they think you can go back to work, but then you file an appeal and go through the process. Can you explain the loophole Social Security has if my ex-spouse and I were married less than 10 years and I still have a disabled adult son I care for still? Okay, so yeah, the 10-year marriage doesn't matter with that one. You're talking about auxiliary child and care benefits. So if the child is receiving benefits and the child is under 16 years old or became disabled before the age of 22 and receiving benefits from the parent's record, and the other parent is staying home to take care of that child, then that parent, they're limited. What I'm saying is staying home, or limited their income to $22,320 this year. If you're staying home or limiting your income to take care of that child, then you're entitled to what's called the auxiliary child and care benefits. So if you're approved, you pretty much receive the same check amount as the child if there's no other children on the record. So yeah, reach out to Social Security. If that's the case, call the 800 number 772-1213 and say, hey, I want to file for the child has to be in your care. I want to file for auxiliary child and care benefits, and they'll set up a claim and get you all set. Does everyone have to have Part D? Yes. If it's your time to sign up for Medicare, Part A, Part B, and all that, and you don't have all the health insurance or whatever, yes, you have to have Part D. And what I see happening is people go ahead and sign up for a Medicare, Medicare Part A and Part B, and then they sign up for a Medicare supplement plan. A Medicare supplement plan just covers the gaps of Part A and Part B, no dental, vision, hearing, and it doesn't have the Part D prescription drug plan. You have to get that as well. If you don't, then you're penalized for the rest of your life, 1% for every month you did not get it. So what I see happening is a lot of people say, the insurance brokers, they help you sign up for the Medicare supplement, and they say, okay, now I need to get you a Part D plan. And then people are saying, well, I don't take drugs, so I don't need it. And the broker doesn't make really any money this year, particularly next year, they really don't make any money. So they just say, okay, fine, bye. And they just go on. That's really doing you a disservice. That's why, like Chapter, they have bucked the trend. They're going completely the opposite way, and they're helping more people out with Part D. They just hired a whole bunch of people to help you with Part D, those standalone. Again, Medicare Advantage, most of those have Part D already embedded in there. But if you have a Medicare supplement plan and you don't have a Part D, then you're going to be penalized. And people say, well, I don't need it, I don't take drugs. Doesn't matter. You still have to have it. If you don't, when you eventually do sign up, next year, 5 years, 10 years, 20 years from now, when you actually need medications and you go sign up, then yeah, you're going to be penalized for years. So I just retired this year, but as Social Security says, I owe extra IRMA because of my MAGI was over 2023. Question, why am I paying extra based on last year's income when I applied for Medicare? Yeah. Call your Congress. Yeah, but yeah, that's how they wrote the law. It's not last year, it's the year before. So it's 2 years back. But if So you retired this year, so maybe that's okay. So it's based on 2 years ago. So if 2 years ago you made over 103,000 if you're single, 206,000 if you're married, um, and that's how they base your IRMA. But that income was from work. If that's the case, and you have since stopped working, you have what's called a life changing event, and you download the form. It's a SSA 44. You download that and say, yes, I made $6 billion 2 years ago, but it doesn't matter because I stopped working last month or a year ago or yesterday. And they will cancel that extra premium. And if you've been paying it since January of this year, they'll return that money. So, all right, we are at an hour, and let's see. I'm going to get one more person that I don't recognize here. Let's see. Oh, I don't think I recognize this one. When my mother passed, a form was mailed from Social Security about possible funds. But when we called the Social Security office, they said over the phone that there were no monies to claim. Advice of what to check. Um, um, yeah, that could be a few things. The final check or something. If there's anybody that were entitled to benefits on your mother's record, if your mother was married and still married, then maybe the husband could be entitled to benefits. If there were any disabled children or anybody under the age of 18. So yeah, they say, hey, there might be possible funds, contact us, and then we'll go through all the questions. And it sounds like they went through all the questions and they determined there's no eligibility for anybody. So that sounds like your local office did their job. So good on them. All right, that is it for today. And if I didn't get to your question, I apologize. I will be back again tomorrow. Cut and paste your question, pop it in the chat first thing, and I guarantee I will get to it tomorrow.